If marijuana is legalized, how will it impact local jobs, the workforce, healthcare, and other aspects of daily living? Well, that's what reporters in the WXXI newsroom have been tracking down. Joining me in the studio are my colleagues James Brown and Brett Dahlberg, here to share their findings and some of the challenges they encountered in their research. Welcome to both of you. Thank you for being here.
Thanks for having us.
So before we get into your individual stories, generally speaking, tell me a little bit about what the process was like for each of you. This is still very much a taboo topic. So when you're trying to get people to talk and open up and be vulnerable and honest, how easy was it? Was it a challenge? Was it easy? Go ahead, James.
It varied a lot. There were some employers who were very, very hesitant to speak to me, especially about the idea of their employees being high on the job. There were a lot of reluctant phone calls. One employer hung up on me as I called, and the other ones, it really took going directly to the executive level in order to get down to someone who would actually speak to us. HR directors in particular were hesitant.
Brett, what about you?
Yeah, so in several of the counties surrounding Monroe, Livingston, Wayne, and Ontario County, there's only one person who's certified to provide medical marijuana, and only one of those three was willing to talk to me, and so that's the one, Janine Quinlan, who ended up in the story. But the others didn't get in touch, and it's still, you know, Janine Quinlan said, it's still, for many people in rural parts of the state, it's not something that people often want to talk about, and it's not something that people are willing to go public about.
Interesting. Interesting. Well, I want to go into each of your stories, and James, I'm going to start with you. You spoke with local businesses trying to really prepare themselves for the potential legalization of pot. So talk about the type of impact that legalization could have on businesses, on employers.
One employer told me that he expects a slew of new firings because he's a zero-tolerance workplace. This was Klein Steel. Mike Young was the president of Klein Steel who I spoke to. And he says that essentially there's an adjustment period that's needed as they figure out testing, as they figure out their tolerance, and whether they would be willing to adjust their, he called it a rigid policy. His words, not mine. And whether they're willing to adjust that really depends on what happens in the first months following legalization.
So did they see any type of, I would have to imagine there's concerns about workers coming impaired. What type of parallel did they draw with you when it comes to alcohol? I mean, I would think the two might have some similarities maybe, or no?
Yeah. In terms of Klein Steel, there was definitely a parallel with alcohol. Any kind of impairment was definitely equal. With the other employer, Optimax, that I spoke to, they sort of drew more of a delicate line, especially with the complication of the marijuana being harder to pick out in terms of testing, because marijuana stays in your system longer than alcohol. So alcohol is a little bit different in that it goes out of your system quickly. So with marijuana, they're really, really looking for more deep, in-depth testing so they can tell when it goes into your system and leaves your system.
Well, Brett, you took an interesting angle with your reporting in that you examined how users and prescribers of medical cannabis, how they could be impacted by the legalization of recreational cannabis, and you focused on rural areas. So tell me about why focusing on rural New York was so important for you.
Sure. So that started when the state keeps a list of who is licensed, who's available to prescribe medical marijuana or recommend medical marijuana, and allows their name to be listed publicly. And there are 26 of those people in Monroe County, and in many of the surrounding counties there's 0 or 1. And that means that it's difficult for people who are looking for medical marijuana to find somebody who can prescribe it. And so my thought when I started out with the reporting was maybe those people will be, maybe people who are looking for medical marijuana will be excited that they don't have to go to that one person, or that, you know, in the one county where there's nobody, they'll be able to just go to a recreational dispensary and use marijuana as a medication. Then the thought is, well, what happens if we think of that as self-medicating? Is that safe, or is that going to be dangerous? Are there complications that can result? And the place where all of that comes together, right, is in the rural areas surrounding Monroe County, and so that's why I focused there.
Interesting. So tell me a little bit about, in terms of the one person, that one medical marijuana distributor that you were able to connect with, what types of concerns, maybe she doesn't have concerns, in regards to the possible legalization for recreational use?
Sure. So I thought when I started that her concerns would be twofold. One would be that it would cut into her business. She wouldn't have a monopoly on people legitimately being able to get marijuana through her anymore. And the other, I thought, was maybe she would have some health concerns. Now, it turns out both of those she is not super concerned about.
Really?
So she said that in a rural area, her business is not, most of her clientele is not actually people who are coming to her for medical marijuana. She works in other areas also. She works in addiction medicine. She works in counseling. And that means that the people coming to her for medical marijuana are actually a pretty small part of her clientele. And so she's not super worried about losing that part of her business. And then the other part, though, about medical concerns, there is a particular slice of the population that she is concerned about, and those are people who have what doctors call contraindications for using medical marijuana, and that means that there's likely to be some sort of complication or some negative outcome if you use marijuana. And right now, the way it's set up, if they come to her and she says, I'm sorry, I can't recommend this, you've got a cardiovascular condition, or you've got a psychological condition that makes this dangerous, she's not going to recommend it. The danger is if recreational marijuana is legalized, now there's another route for those people to get it.
Wow. All right, lots of unanswered questions, and we will find out hopefully very soon. And we are out of time for now, but a special thank you to my guests, my colleagues in the WXXI Newsroom, reporters Brett Dahlberg and James Brown, for joining me today. And you can check out their reports and others on this topic from the news team, and you can also get your latest updates on recreational marijuana legalization in New York. Just go to WXXInews.org.